Spay or neuter is a very important procedure that needs to be done on almost every animal. And the importance of it is breeding, so there won't be unwanted puppies in the world. For the female animals, it helps to prevent breast cancer. The fewer times they go through heat cycles, the lower their chances of getting breast cancer. There's also a condition that happens later in life. The more heat cycles you have, the more likely you are to have it, and it's called pyometra. And that's where there's an infection in the uterus, and the uterus will swell up almost like a giant appendix in a person, and it can burst. It can be fatal. For the boy dogs, prostate problems, prostate cancer, and testicular cancer are all greatly reduced or prevented by neutering the dog. It also helps with aggression, so neutering them will help them not to be as aggressive with their housemates, less likely to mark things in the house, and marking and territorial behavior, and then less aggressive with other dogs outside of the house. They tend to be a little easier to train and a little more focused on the family and less focused on maintaining their dominance in the neighborhood. The spay procedure is a routine surgery. That said, it's anesthesia and your patient is completely anesthetized, and for a spay you have to go inside the body cavity and take out the ovaries and the uterus. There are always chances of complications. Anytime you're under anesthesia, you need to be really, really aware and vigilant about monitoring things like blood pressure, oxygen saturation of the blood cells. You need to be on an intravenous fluid to help protect the fluid level in the body. You need to monitor the temperature. So it's important to have a separate person there monitoring anesthesia. We feel it's critical to be with an IV catheter and IV fluids. And then we monitor an electrocardiogram, blood pressure, pulse oximeter, and end-tidal CO2. So all of those will give us the fastest indications if there's anything going wrong. Probably one of the most critical steps in the surgery itself is the anesthesia. And then you want a separate surgery room, you want separate surgery packs, and you want absolutely sterile asepsis for the whole procedure. So we take it very, very seriously, and we treat them here like they're having any other abdominal surgery.